We are on the medicare.gov website. This is their homepage, and we are going to preview 2021 health and drug plans. I would highly encourage you to create an account if you do not have one, as this will save your information and you do not have to do additional work re-entering information if you need to go back in and look at something a second time or any other times. And there's a lot of information you can get on here. So I really encourage you to create an account. But as we don't have one for this illustration today, we're going to continue without logging in. And we are looking at the drug plans that are available in the Evansville area. We are in Vanderburgh County. If your zip code overlaps multiple counties, you will need to choose your county of residence. And we do not receive any assistance from these programs, but if you do, this website, once you select it and choose the right level of assistance, will automatically apply those costs to your final illustration. Now I have added a drug list here. And we've got fentanyl patches, a box of 5 patches. We're doing 2 of those per month. We've got hydrochlorothiazide, 30 pills per month, so 1 pill a day. A Lantus pen injector. It is a pack of 5 once a month. We've got potassium chloride, 10 MEQ once a day. And we've got the zolpidem tartrate, 10 milligrams once a day as well. When you're in here and you want to add your drugs, find and add drug, clicking there. And then we're going to start typing our medication, and the website will auto-populate the prescription for us. We're going to do simvastatin, add drug, and it gives me the dosing options. I will choose 5 milligrams and once a day. Every month. Now, if you can change your fill frequency, 2 months, 3 months, 6 months, or 12 months, but I'm going to leave it at once a month. Add to my drug list, and I'm going to finish. This is my complete drug list for now. I'm done adding drugs. The website is going to auto-populate or pre-populate pharmacies that are within a 1-mile radius of the 1-4 zip code. I can extend this out all the way up to 25 miles should I want to, and see all the pharmacies that fall into this range. I have selected the mail order pharmacy, CVS, Walgreens, and Walmart. I want to see the cost there. And this page brings us to the drug plans that are available. Now, there are 30 drug plans available in the state of Indiana for 2021. Every single one of them is different, and they all cover drugs differently. We like to sort the plans by lowest drug cost plus the premium cost. This gives us the overall cost expectation for the year, but you can also look at which plan has just the lowest deductible or the lowest monthly premium. Now, when these are organized here, this is our lowest cost estimate with the prescriptions that we've listed. If I scroll down, the cost is just going to keep going up. It's not just the premium that we're looking at. It is this column here. It's this box, the yearly drug and premium cost. And it just keeps getting higher as we scroll down. So just within these first 10 plans that are listed on the first page, the cost goes all the way up to $1,800 versus just over $1,100 on the lowest cost estimate for the year. Now, because I've added insulin in here, it's giving me this tip that says there's insulin savings. There are plans that are specifically offering a lower insulin cost because they are participating in a program called the Senior Savers Program. If I click on this to add this filter, it is going to change the plans available. Well, it doesn't change the plans available. It just narrows it down much more from 30 plans down to 9 plans. The Mutual of Omaha Premier Plan is showing as our lowest cost option for our prescriptions. It's showing me the monthly premium is $23.60, and the full cost with all premiums and all co-payments is just over $1,100 for the year. Now I want to look at the plan details so I can get some more information. So we'll click there. We're seeing the premium again. And this plan does have a $445 deductible. However, that might not apply to all medications. For example, many plans do not apply the deductible to lower tiered medications. The deductible will apply to tier 3 and above, which means that you would pay full cost for that medication until you have satisfied the deductible, and then you pay the copayment for that prescription. With tier 1 and tier 2 generics, you go right into paying your copayments at the beginning of the year. Now with our pharmacies, there are pharmacies that can be preferred pharmacies or standard pharmacies. And depending on if they're preferred or standard, could have an effect on your copayments. For preferred pharmacies, the tier 1 cost is $0 per month. For tier 2, it is $2 per month. Tier 3 is a 23% copayment. Tier 4, 46%, and specialty tier is 25%. If I change this to standard, that ups the preferred generic to $8 per month, which is tier 1. Tier 2 jumps up to $10. Preferred brand goes up a couple of percentage points to 25%. Tier 4 goes to 48%. And tier 5 stays at 25% of the cost. And Walgreens is a standard pharmacy. CVS and Walmart are preferred pharmacies. So we're going to go ahead and scroll down here and look at the cost breakdown between the standard pharmacy and the preferred pharmacy. Now with our fentanyl patches, we're seeing that it is $49.21 before the deductible. Hydrochlorothiazide is $3.21. Lantus is $25. Potassium is $10. Simvastatin is $8. And Zolpidem is $3.81. We are not going to meet our deductible for this year. So we'll look at what drugs might be applying to the deductible here in just a second. So that total cost at Walgreens is just over $1,300. For the standard pharmacy. If we scroll down and look at a preferred pharmacy cost, the total out of pocket is just over $1,100. So $1,100 versus $1,300. So we're looking at about a $200 difference to go to a preferred pharmacy over the standard pharmacy. This again is showing us that we are not going to meet the deductible for the year. And our cost for the prescriptions is slightly less. If we looked at the mail order cost, it is lower still, down to $948. So your biggest cost savings with this plan is going to be on the mail order pharmacy. But you don't have to use mail order if you don't want to. But your biggest cost savings is going to be through the mail order. Now this shows that we're going to meet our deductible in January, and we will go into the donut hole in October, and we will not leave the donut hole. Now that is unavoidable. The donut hole you cannot get away from. Every drug plan has the potential for going into the donut hole. It is based on the full cost of your medication. That determines if and when you're going to go into the donut hole. So you can't get away from it if you have higher cost medications. Now I'm going to scroll down here a little bit to look at how the prescriptions are actually organized into the different tiers. We've got tier 1, tier 2, 3, and 4 medications. And we have a little bit of utilization management on these prescriptions, prior authorization, quantity limits, and step therapy. With prior authorization, The doctor is basically going to have to fill out a form explaining why you are taking that medication, and the plan will have to approve that before they're going to fill your prescription for you. On quantity limits, they're going to limit how many pills you can have in a specific time period. So with the fentanyl patches, they're only giving 10 patches in a 30-day supply. With simvastatin, it's 30 pills in 30 days. And the zolpidem, which is the generic for Ambien, is also 30 pills in 30 days. Step therapy is the most restrictive utilization management, and that requires you to try a different medication before the plan will pay for the medication that you are taking. Now, the fentanyl patch, because it is a controlled substance, there might be additional safety review for this prescription. If we need to verify that we've input the information incorrectly, that is down here. Or if we need to add or remove a drug, we can click on this button and it's going to bring us back to the adding of drugs page, and we can make those adjustments from there and then reevaluate the plan selections. If you want to enroll in your drug plan after you have looked at the various plan options that are available, the enrollment button will be in the top corner right here. But as annual enrollment has not started yet, that button is not there. But if you clicked on that button, it will bring you to the enrollment screen, which if you're logged into your Medicare account will pre-populate most of the information. If you don't have your login information, you'll have to enter that in. That is your name, birthday, address, Medicare information, and the like. Now, when you get to the billing information, we would recommend that you do the direct billing statement. You will move through the enrollment process, and then you will have the option to print out your application and your confirmation page. The plan that you've enrolled in will send you a welcome letter within 10 to 14 business days of your application. And then they will send you your enrollment materials after that. So you'll get multiple packets from your plan that you have chosen. If you want to enroll from your plan selection page or all of the options, the enrollment button is going to be right here. So you don't have to go into the plan details to enroll. The enrollment button will be right here. So there's going to be multiple ways that you can enroll in the plan. You'll walk through the information, confirm your enrollment, and that is it. That is how you review a drug plan and how you enroll in the plan through the Medicare website. Thank you for your attention and best of luck.